We are excited today. We have a super special guest.
I moved to New York City where people come in psycho for like IPLs and their skin type 1s. I could see through them. I'm like, wow.
There are lasers that have come about recently that are more of a fad.
I don't think that people truly understand the value of basic skincare.
I just need an NDA real quick.
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way.
We are excited today. We have a super special guest, and it's our first guest on the podcast. We have Raechel Lowe Jaap with us, and we are going to talk all things about lasers, business ownership. We're going to talk about the patient experience and what to expect when you go to get a laser treatment. So we're super excited to have her. Welcome. I'm going to get a little bit into it. So she is a licensed esthetician, a licensed laser technician, a nail tech, a clinical trainer. She's a KOL for Cartessa. She specializes in cosmetic laser treatments, radio frequency, microneedling, exosomes, PRP, scar camouflage, microblading, areola 3D tattoo, the list goes on. She is a certified laser safety officer in the state of New York. She's a clinical teacher for laser hair removal and paramedical aesthetics. And she's a recent business entrepreneur, and she just opened her practice here in Tallahassee called The Aesthetic Blend. She trains for Cartessa and is the director for laser services. She also created a skin of color course that specializes in treating skin of color safely with lasers, and she's an educator. She helps nurses and estheticians advance their careers and engage in advanced treatments. She's also a brand ambassador for many of the brands that we love: Oxygenetics, Noon, Hydrofacial, Crown Aesthetics, Plasma Pen, Chimera Exosomes, and Clear Choice Chemical Peels. So, wow. That was quite the intro.
Thank you.
That is a resume that I hope to have one day.
Me too. So she's been doing this for how long?
25 years. Yeah.
25 years. So she's a wealth of knowledge.
Yes.
And I think that let's kick it off with just like a fun question of like, what is the biggest misconception that you feel like estheticians, laser techs, injectors are still getting wrong about lasers these days?
I mean, the first thing that pops off my head is when someone gets trained how to do a treatment like a protocol, that to them is their gold, their Bible. They don't think, let's think outside the box, or they don't learn enough about, they're not critical thinkers with the treatment. Maybe they don't understand every aspect. So I feel like they get trained and then they just go into it, but they don't understand why certain things are happening. And that is probably the one misconception. I feel like, let's buy this $200,000 laser. It's an ATM machine. And that's not, I think we know, not the case, right? It takes time.
Yes, can speak heavily from experience
same.
over here. I think that's a huge, that's not even something that I would have thought about, but absolutely. You really hang on to the settings that the company gives you as your only settings that you can use. And you can tell us from experience, and with working with a laser company, do you feel like the settings that they give you are safe settings, but not necessarily going to give the best outcome settings?
That's a good question. When they come up with their settings, they're usually run through the FDA to be like basic settings to accomplish a result. And they're a baseline. If they were really accurate settings that were aggressive, then the FDA has to look at what are some adverse event possibilities. And so they always give lower settings to start at. And as you know, sometimes those settings could be too high if they're not skin typed properly, or if they're using certain medications. And so I think it's really important to understand, it's just a starting point.
Right.
And then you kind of just do a test patch and build from there for your clinical endpoint,
Yeah, I feel like that's the main thing that, well, among other great things, but one of the main things that you have really opened my eyes to is looking at the patient as a whole, figuring out what the laser is actually going to do, what is our goal, what is our end point, and then going from there. It's really all about thinking critically, and I feel like just in the short amount of time that we have spent together, when you were at Naveau and then now off on your own. I've learned so much about lasers, and I think that's the common misconception too, is like you can just walk in, like you said, and it be an ATM and you just get a laser done. Lauren and I'm sure you have had that experience where someone's like, I want this laser. Like, why can't we do it? I had that experience, and I'm like, you have no idea what this laser can do. And you know, we are obsessed with Cartessa and the CO2 laser that you have brought into our lives, and she was asking about that one, but yeah.
I think companies, I'm going to call out Hydrofacial. They have done an amazing job at branding, because I wouldn't want to use any other aqua facial delivery device besides Hydro. People literally come in and ask for it.
And ask for it by name.
Mm-hmm. Yeah. So I've stuck with that company as a provider. I've done a lot with them, but over the past couple of years, major change in that company to the point where they're not doing those marketing things. They're not, the quality of care for providers has gone down. So then I've been exposed to something else that wasn't branded, but actually when I used it, I was like, wow, this is actually better than what I've been using. And so I think it takes a lot of bravery too as a provider to step outside what patients ask for and make a choice to get something that you feel will be better.
Right.
More ROI for us, but also more options for the patient. And that to me is like winning.
Yeah, and like the stacking of treatments, I know Lauren does a great job at stacking treatments, but like through you, I feel, again, it just goes back to like you expanding the options, and you've made me think about what all I can offer in this period of time to give them the best result.
That's what it is.
How do you think that you approach a brand new patient who comes in and says they want a laser treatment? What all are you looking at to determine the best treatment for that person?
You mean like if they're coming in to say, I want a BBL, but they may not need like a brand name, or they're just like, I want to try laser.
Yeah, I think just like in general, I want to try this. I've never had anything before. You know, what are you looking at to make the best either stacked recommendation or treatment recommendation? Kind of walk us through that.
That's a good question. And I love how we've been talking about stacked, because that is like the true customized approach. And I find that when patients come to you, they want the result. They don't really care about the steps that you take, the brands, they just want the end game. And so when a patient comes to me, the first thing, I hear everything that their concerns are, and I look at the quality of their skin. And that is so important to me. I never used to take that as seriously until I worked for a facial plastic surgeon, and she would be like, they have to be on all this skincare before we do a facelift. And I'm like, can you, I'm just out of curiosity, explain? And she says, well, I can cut and tailor a fine suit, meaning like a facelift, but the quality of the fabric has to be there. And I don't know why, after doing this for so long, I stood in my tracks and I was like, wow, well, let me think of it. Like, if someone comes in with dry skin and I'm using a laser that looks for water, the energy is not even making a connection. They're not even going to have a result, but they're paying this money, and then I look like I didn't give them a good result. So I'm going to back up and I'm going to take a look at whatever their concerns are. For example, if they have brown spots, I know all lasers love pigment that I'm going to use for pigment, but they also love water. So I use that as a technique to enhance that laser beam going to that target and absorbing fully by having the second chromophore of water be a strong chromophore. So I look at it as a canvas, and I have to prep the skin before I do any lasers. And I never did that. I would like jump, oh my God, you're here for laser treatment?
Absolutely.
Okay, here's the amount. Let's just start today before you change your mind. But once I started realizing that like I'm not getting good results, or I have to turn my energy up so high to get a basic result, I just changed my way of thinking, and I want to say Hydrofacial probably helped me, because when you put the target of water in the skin right before you laser them, and then you do a laser, you can get better results by doing lower settings and multiple passes, and you could do more stacking is what I'm trying to say.
Yes.
So your stacking ability is better when you've prepped properly. And you guys are really good at that with skincare, with your patients. And I felt like you've taught me that I need to be better at that, right? I would be like, just be on these basic things. But I actually overlap with a lot of your patients, and they have really nice results, and they recover much better because of all those advice that you've given them of the products for their skin. So I have to like really hand it to you guys. I need to do a better job.
So PSA, patients, you heard it here from the laser guru. You have to prep your skin for lasers. You cannot walk in off the street and get your laser treatment and be done. We literally preach that all day, every day on this podcast to our patients. But now you've heard it from an expert.
Yeah, it's a waste. You fire laser on dry skin, it scatters. It goes into like a cloud, and yeah, you don't have any therapeutic benefit. So.
I had a patient this morning say, I'm not here to buy all of that skincare junk. I just want to get the laser done. And I was like, well, you know, all of your results, all the money that you invest in this laser could be 10 times better if you did some skincare. And I don't feel comfortable as your provider doing your laser if I have no idea what you're prepping your skin with, if you're even prepping your skin. Do you wear sunscreen? I had another patient say it didn't matter what I said, but she wasn't going to wear sunscreen.
Ever.
It's
You
been
know
a
that
week and it's
picture
only
of the
Wednesday.
trucker, the woman trucker that's the side of her
Yes.
face? I feel like we should carry that with us
Around.
and be like, she didn't wear sunscreen on this side.
Yes.
We should.
But
Or the ones
or
that,
the
like, you know,
retinoid
you
one.
see the guy that was a farmer and
my
his
gosh, yes.
legs are pale and his arms are eaten alive with
Yes.
just sun damage. And I don't think that people truly understand the value of basic skincare.
There's basic things, and I think I learned, I'm from South Florida, so my first exposure to patients in skincare was skin types like 4 through 6, and you know, it was very much like everyone had sun damage, so to me that was the norm. Then I moved to New York City, where people come in psycho for like IPLs and their skin type 1s. I could see through them. I'm like, wow. So but their skin health was so much better. Like, I'm not saying everyone up there, because you know, they do the tanning bed, the baby oil, the iodine, the reflector, but I just noticed that people were absorbing the energy and responding better from treatments because they had general overall less sun damage. So
Right.
coming here, again, it's not as bad as South Florida. There's so much prep that has to be done before I will treat someone's arms and legs for stuff like that, because I don't want to spin my wheels.
Yeah.
For
I mean, that's
sure.
really valid.
If you could design your most perfect, like a laser that doesn't exist right now, what would be your perfect treatment?
I just need an NDA real quick
I know.
for everyone to say no. Oh gosh, that's so hard. That's really hard.
I know, because you've seen, I mean, I assume you saw the new Sciton
Yes,
Tribrid,
yeah,
that Tribrid that just came out.
I love Sciton for their, I love erbium, and that's why I love Cool Peel so much, because Cool Peel actually acts like an erbium, and then you go, I love Sciton, and I love the BBL, but where I struggle is kind of like on the body when you do a treatment and that spot just won't completely clear because it's deep. So if I can have a long pulse, if I can have like a BBL technology with like also a long pulse YAG and like a long pulse maybe Alex, I think I would be so happy, because then I have the ability to go deeper into the tissue. And obviously I love all of the non-ablative stuff, but I find that pigment and reds are like I have a mission with reds. You know how bright they are? Those bright ones are so tricky. So
All right, dumb it down for the audience then.
Okay.
What do you mean by long pulse and
Okay.
a Alex YAG?
So certain lasers touch the skin, and we don't want them to touch too long because they could create a burn. But when they touch the skin just right enough, we know through science and our recommended settings that like that is going to be there for a right amount of time to treat the depth of a pigmented lesion. But when you talk about technology of an IPL, which stands for intense pulse light, and a BBL, broadband light, those two technologies cover browns and reds at the same time, but they're limited in how deep they can go. So you're never able to fully clear a deep lesion. So on the face, neck, chest, like we know that that works well.
And a deep lesion, sorry to cut you off, that's lighter pigment that you see, correct?
It could be.
Okay.
That's what you see after you've treated it and you've knocked all the
And you
pigment off the
can't quite
top,
get
and now
it.
it's light. Now
Okay.
here's your secondary issue. When it's so light, the laser has a hard time seeing it because it's so light, and you're kind of stuck with, well, like, how do we eradicate this? And it could be with cool peels or ablative things. But if you start off with a laser that can stay on the skin a little longer and it still be safe and get to the bottom, that's kind of where I'm at. It's also not as safe. So if someone comes in, first visit, they have a lot of pigment, they really need a BBL or an IPL at first to knock that superficial pigment.
Okay.
And then maybe the next visit, you're getting into a laser that stays on the skin a little longer to get to the depth.
Do you have a
Yeah, so
type, a brand that you like?
Not a brand, but the wavelength I like is just an Alexandrite laser. That loves
What wavelength is that?
755,
Okay.
and it loves pigment, and it also loves red. So if you get red spots that are dark red, like those little round spots on your body, like angiomas, that also loves those as well. Those bright pinks, that's where you need to be in the range of like the 532, 550, and that's very indicative with the IPL and BBL technologies. And usually those are superficial.
yeah. So your Alexandrite can get those deeper lesions.
Yeah.
That
It's
deeper
really the
pigment.
only technology that exists for deeper dark brown. Now, then, you know, those seborrheic keratoses. So for people that aren't medical, those brown spots that get rough and kind of thick as we age, those are that wavelength will eradicate those because they're thicker. It's a little aggressive.
It will.
Yeah,
Okay.
and then you can always
even
use
without
it to-
ablation.
Yeah, so there's a device called Candela GentleMax Pro, and they actually have protocols on their 755 for those, and it's a little aggressive. You hit it, and you hear a pop, and the whole thing kind of opens up, and you're like, are you going to be okay? Call me tomorrow. Keep ointment on this. Yeah. And then when you see them in a month, it has peeled off. The skin's kind of a little bit of pink, and that was at one treatment.
Wow. So
go
do you
ahead.
feel like within the laser space, there are lasers that have come about recently that are more of a fad? Or like, what do you feel like are your, tried and true, these will always stand the test of time, they're not going anywhere?
Yeah, I think anything that Sciton makes is not going anywhere, that's for sure.
Do you think, again, that goes back to like hydrofacial, how much marketing and how well they do marketing, or is the BBL technology like that much more advanced?
So BBL technology, I wouldn't say it's much more advanced. So IPL in general is dangerous to sun exposed people.
Yeah.
I'm sure we've all seen the chest with the squares, or someone's gotten burned.
I've gotten that myself.
Yeah, same. I've been there. BBL, their technology is amazing in the fact that the way that their handpiece is built, when the light goes in the skin, it's an even, it's called a Gaussian beam. It's an even energy delivery. IPL in general is Gaussian, so it's very high energy in the middle. So if you're overlapping as a provider, there's so much heat going into certain spots, it's uneven. That's scary for me. So if you have a lot of pigment, you're getting uneven heat.
Got it.
BBL has knocked that out and kind of put 2 flash lamps in the handpiece, made it a top hat so it goes in even, and that's their technology. That's why they're so good. Then fast forward, they were able to figure out how to put that on a platform with ablation. So if you're a provider that just wants one device that does it all effectively and very well, that's what they've done well at.
The BBL
You have your
Moxie.
cool peel, which is awesome.
Yeah.
You can go deep or superficial, but you don't have color.
Yeah.
Right?
Yeah.
So I just think that Sciton put the most wanted
I
technologies.
know
in them.
Cartessa needs their like Modus type handpiece built into
do.
the Helix next generation.
They do.
Yeah, everybody, our listeners know how much we love Cartessa, specifically the Helix, and this is the reason why she's a KOL
I wish
for
I had a
Cartessa.
Helix. I love.
I know. You have the Tetra.
I have
right?
the Tetra Pro, which is missing that non-ablative 1570 wavelength for heating and more contraction. So when I was at Nuvo, I was doing a lot of treatments and I loved it. And I opened up my own place and I had all of a sudden 3 and 4 lasers to buy. So I just went with the Tetra Pro and I love it. And I have to utilize other technologies to get what I get in one Helix treatment.
Right.
But I definitely notice a difference. But what I have been using it a lot for is tattoo removal, which has been amazing for me. It's been a game changer for tattoo removal. I'll share that with you guys.
Tattoo removal people are hard. Patients are hard.
So hard.
How do you feel like they fit into your practice? Because they're not all cosmetic. Some of them are just there for a tattoo. So how does that work? How do you blend aesthetics and then the tattoo removal?
Something I learned is like that conversion rate is generally not happening, and that's fine. I'm there to help people. But what happens, again, we were talking about pigment. If it's too deep, it's hard to treat.
Yeah.
So when we're treating tattoos, we don't know how deep this tattoo artist went, what kind of needles. And my struggle is tattoo removal lasers work, but they can only go so deep. They're short on the skin. They're fast. So it probably can't go generally over 1 millimeter depth into the skin. Tattoo guns don't even have a gauge that tells you how deep you're going. They're just like having this long needle. Oh, if it's bleeding too much, let's pull back a little bit. It's kind of crazy that this exists. And ink is not regulated. So I can literally mix up some eyeshadow and some water and
That is
Everclear
wild.
and tattoo it in your skin. And not break
Everclear?
the law. Yeah, seriously. They use
Yeah, you told me that there's like this invisible ink, this white ink that makes tattoos hard to
Yeah,
like, get
it's
through.
a silicone sponge that they actually start putting drops into, microscopic silicone sponges. They drop into any ink color, and as they're tattooing it, it holds that ink in place so it doesn't spread and it's bold, and that's great. But if someone gets tired of that tattoo, laser tattoo removal, all it does is it goes to that ink and shatters it, and your body's removing it through phagocytosis. If you have a sponge holding it there, it's never going to be able to clear, and we don't even know that till we've done a couple treatments.
Oh.
And that's where you feel like the Tetra works really well to break through that.
I feel like that, and also when you get to like visit 6, let's say, and you are just left with these dots where the needle went deeper than the rest of the tattoo, the laser can't even reach that depth. So then I've been coming in with kind of like cool peel settings, bringing the dots very close together and doing a treatment right on top of a tattoo removal treatment. And when they come back, it's like they just had 3 out of 1. And I've been doing this the last 2 months. And we actually shared a mutual patient with facial tattoos.
Yes.
I actually will send you this picture if you want to put it on your podcast. This guy had 20 something treatment, like before you came back, simple face tattoos on his cheek done with some black ink. And basically tattoo removal wasn't working. He would respond, he would frost, but never clear. And so I started utilizing the CO2 right on top. And he said, let me tell you what happened the first time. He put Vaseline on. I would never tell anybody to do this, but he would goop Vaseline on. And after 15 minutes, like wipe it off, like a thick layer. And when he wipes it off, he could see on the gauze or the paper towel, the scabs that are coming out actually have ink in them.
Oh.
So this is good,
Softens them with
right?
the so then I was like, well, I don't believe you, but let me see. So then it's like night and day, and I've only done this like 3 or 4 times. And so like, again, CO2 loves water. So it's going into the skin, making a column into the skin like a needle, but it's evaporating any tissue that has water in it as a byproduct, the ink. So it's like completely off label, but you're just kind of trying to remove the skin with the ink in it. And as they scab up, it's coming off, and it's crazy.
That's crazy. I mean, you are exactly what Tallahassee has been looking for in terms of treating things that no one else knows how to treat.
For sure.
And especially, like, I want you to talk a little bit about your tattoo camouflage and, you know, the skin of color education that you created and came up with, because I think that's just phenomenal for our breast cancer patients, for patients who need a color tattoo, say they, you know, got burned with the laser or something.
And they need something to cover it up.
Yeah, walk us through that, because I know you're passionate about that too.
Well, do any of you have scars? Because a lot of people have scars. Let's talk about if you had a scar. So we know what it feels like to not like our scar, but what if that scar was like on your face? Let's say you had a facelift, or you have these scars to remind you of like breast cancer. I felt like I lived in New York when COVID happened, and we took a break and we came back, and people were so ready to get back into treatments, but the vanity that I started developing like a disgust with, and if any of my patients from New York hear this, I love everyone, but there was a point where people were like, this one brown spot won't go away and it's literally ruining my life. And I'm sitting there like thinking about all the people that are like dying from COVID, and I just thought to myself, what am I doing? That's not what I want to do. So I kind of, at the end of COVID, retired and went to a corporate role. Being in a corporate role, overseeing laser technology and science at this company, I saw a lot of adverse events. It's like people weren't asking your genetic background. Maybe you look light, but you're really a skin type 4. So I started just trying to like, how do we not make these mistakes, and enforcing those. That's how Skinclusive came along, right? So people, if you're from an area and didn't have a lot of darker skin types, lasers love pigment, so they're not safe for all. So just kind of how to teach yourself to be safe when you're dealing with melanated skin, okay? And then the other one was
Scar camouflage.
Yeah,
Scar camouflage.
Because you're doing a lot of nipple tattooing
Yeah.
for breast cancer patients, and I know you're phenomenal at it, and you love doing that. Yeah, just like the tattoo camouflage, like.
Yeah, I think working in derm, there's a lot of Mohs surgery, and patients would be devastated on their face or nose to have these horrible scars. So I first started getting into doing things like, let's tone down the redness, let's microneedle the texture, let's pull this pigment and stuff out so that your scar at least looks better. And then when I decided to move to Tallahassee, I said, like, I really have a strong urge to help patients with scarring. And I was a tattoo artist, but I hadn't done a lot of skin tone coloring. And then I saw this system come out called New Conceal, where they put a reader on the skin and it tells you exactly what ink you are.
Are you using that now?
Well, I started using that at first, but those inks, to my knowledge, they're not good quality inks, and everybody healed yellow. So then I started researching other ink lines, and that's what I'm doing. But what helped me when I moved here to Tallahassee is I knew that if I was going to start seeing patients, I need a way or a special niche. Don't you feel that aesthetics is getting so over diluted that if you don't have a special niche in something, you have to sub niche, you might struggle. And so I thought, I got a job with Tallahassee Plastic Surgery, and what do? They make scars all day long.
Yeah.
So every single person in there is getting scars. Send them my way. I'll do a little scar treatment. And I'm sure you guys can agree. When I started, I had an interest in scars, but I kind of evolved to what I feel like clients needed, to what the community needed. And that also feeds my soul because I'm helping people erase something that makes them feel uncomfortable.
Yeah.
And Tallahassee does not have that. So it was great to bring to the table.
Something new. And it is new. And I think opening that med spot's not like a typical, like now you can come in and get a nice facial. But when I opened, it was like, correction. We're here to just correct things. We're here to help you. And even working in a doctor's office or a derm or a plastic, I'm like the proceduralist, right? They'll tell you what you need, but I'm the one doing those little procedures. So I just kind of brought that within my own, business.
Yeah.
And you have always worked with other physicians and surgeons and people in the medical community. You came here and worked with plastic surgeons. What was the turning point where you go from employee to entrepreneur?
Let's hear about the aesthetic blend.
Yeah. I want the real raw truth.
And let's clear up misconceptions.
I'm like pausing for a
too.
second before I answer, but go ahead.
Well, I was going to say,
have we even said like how we were, kind of like what I was doing and like how that happened?
We could go into the background of just like, you were at Tallahassee Plastic Surgery Clinic, and you are a phenomenal esthetician, laser technician. We thrived with you there. Everyone knows that
we were collaborating, sharing patients.
Which we still do.
Which
and
we still do,
I'm very
thankfully.
grateful for that. Yeah.
Yes.
I basically have never, ever worked without a physician. I love things that are more advanced to do. So it was a big decision for me to break off. However, I knew before I started Tallahassee Plastic Surgery that I was going to open a place. But it was going to be a school, a Florida State laser school, which I still intend to do. But what I thought was I'll work here 2 days a week and I'll have my school. What happened was as I started working there, changes took place within the workplace. And I quit my corporate role full-time a little over a year ago, which was very hard because I love my corporate job. I just didn't want to travel. So for me to quit one corporate job that I was so happy with and making good money and successful, it had to be for like I was ready to go. So when I was working for Tallahassee Plastic Surgery, there was a little bit of a shift in how that business was being run, and I tried it for a year. And towards the end of that year, I just felt with all my experience, and I've run aesthetics within private equity companies, so I've already been there as a manager. So to now be somebody that like nobody knows and I'm being managed by this, it was just so hard for me, and I felt actually that it was affecting my thriving. And I put up with it for a while because I don't want to leave. I love my team. But after a while, you start to realize like it's time to do this. And very scary, I'm not a physician, and I bought tons of lasers. I have staff. I
took a big leap.
I even lived here for 2 years, really. Like, it's, scary. But I felt that everyone in my life here especially was like, bet on yourself. You can do it. And I found a different physician that agreed, said, I will back you up. I'll be your medical director. Interesting, because he's not a plastic surgeon. He's not a dermatologist. But if I ever need anything from a plastic surgeon, my very best friend, Yael Halas in New York City, is at my fingertips. I have many dermatologists, local one here in town, and then many around that are also my mentors. So if there's ever anything I don't know, I'm sending pictures, I'm consulting with my mentors. So that's how I keep in line with that kind of stuff. And then my medical director, if I ever need anything, he's there for me too, obviously. But as far as specialty-wise, then I also have you guys. So if there's something, I'm not in the injector space. Sometimes we have scars. For example, I have a young man who has really bad box scars, and I'm working on some things for him, but I need one of you to put a little bit of filler to pop those up. So it's really nice to have a team, and I will never have injectors at my place unless it's you guys, because I'm always going to work with you where you go, because I do feel like we have a lot of similar beliefs and we work very well together.
Yeah. How many employees do you have now?
2, 3, 4, 5.
That's amazing.
4, and just started with my 5th.
What would your advice be for anyone who is looking to get into aesthetics or lasers, an esthetician, and doing this on their own?
I think exposing yourself. I feel like everyone that's worked for me as a receptionist or assistant is now going to school. So my receptionist starts aesthetic school in 2 weeks. Faith is starting laser school.
Oh, that's
Awesome,
amazing.
though.
My previous receptionist, Taylor, also went and graduated. So I think if you're interested in something, just exposing yourself to it. And I do think it's hard to break into aesthetics if you're new because it's very diluted. But if you just pick like a sub niche and get really good at it and then just add more things as you go.
Yeah.
Yeah. And clearly
Don't
you're
you
inspired.
agree?
I do. And
We have that same situation with our assistants. They're both estheticians.
Yeah.
right.
And we had an episode that was sort of like, how do you become an injector? How do you dive into aesthetics? And it was immersing yourself. Like, be the front desk person, be be the help, be the MA, because you learn so much day in and day out. I mean, Maddie should be able to inject Botox at this point.
I mean, she gives consults all the time
Yeah.
too, and I here. I also think when you go to events, conventions, you meet other people and you talk. So like if I didn't still go to New York, some of the things I offer I wouldn't have even known about. And I go to conventions, so I think just exposure.
And I think that's what Lauren and I have always loved about you and thought was very inspiring too, is that you are constantly educating yourself. And that's what you need in this space because it's ever changing. And there's so many new technologies out there. Like
I know.
Saiton just came out with a brand new laser. So
What are you doing next?
Oh my goodness. So I was going to tell you, as a local business in town closed down that does laser hair removal. And I was trying to tell you before, my husband's like, no more lasers. Like, we're going to get in a fight about it. And I'm like, okay. So then like this place closed down and they reached out to us. Hey, do you want to buy these lasers? And I was like, no. But the girl we hired worked there and has a following. So all my husband did was talk to the guy. He comes home, he's like, we're picking up 2 more lasers. I'm like, oh, look who said no more lasers, who got bit by the bug. So I never know what the next thing is because I feel like things just kind of fall in my lap. It's hard to say. I feel like I'm pretty...
well, the next thing is
I mean, I'm not...
using those lasers. So
Yeah,
I mean,
that's
Yeah,
right.
the next thing is just basically utilizing the lasers. But I will tell you that the tattoo thing is really exciting for me because you get to a standpoint, and besides excision and tattooing skin tone over it, there's really nothing that can clear it. So if I can just nail that protocol down and probably pass it on to like Cartessa or something so that we have protocols that other people can now that have these 2 devices could start using. So that's kind of my little project now.
oh, that's awesome.
And
Really quick, because I think we were like all over, like, you do this, you do that. Just say what people can find at the Aesthetic Blend, what you offer, in case that they're listening and they would be a good candidate.
I think I like to focus on corrective things. So at the Aesthetic Blend, you can come in and have a consultation with me. And I just focus generally on skincare, skin health. And right now we're doing a ton of like browns and reds and just evening out colors. Like imagine putting a filter on yourself. That's kind of like the things that I do. If you were to come to me and needed and had too much movement, let's say forehead or crow's feet, and you want me to like soften those lines, I'm just going to send you to Lauren or Megan and then come back later. But we do now offer facials, so fluffy facials, relaxing. Kaylin will relax you. She's got crystals and sound baths, and your skin is like glassy and glowing when you leave. So that we've got that going on. We just added IV hydration therapy, GLPs, NAD with Nurse Sarah, and then we just have a new person that's starting that is amazing in town with eyebrow laminations, eyelash extensions. So those fun things that you don't have to drive to College Town to get if you live up in this area.
Right.
So I'm trying to just offer like concierge things at a higher end service to people that are in our area here.
Well, and from someone that people can trust. Because,
yes, yeah.
you can't, like, there's so much IV therapy, this, peptides, that, and it gets thrown around. And so I would certainly go to you guys because I trust that you know
Yes.
and you've educated yourself and you have the knowledge.
And I don't
And
want
Sarah's a nurse, right?
She's a nurse, an ICU nurse. So
Yeah,
like if you
exactly.
want
You're
anybody,
in the best care.
You are. And we also, she's working with a company called Qualify. So even though we have a medical director, when you come in that day, you're getting on a telehealth in our room with her in the room that day with a physician going over your medical health before we do anything at all. There's also an integrative health a physician that's moving in downstairs that could do things like pull your blood, send some tests to figure out exactly what nutrients you're deficient on, and we can have those put in there as well. So we want to stay within our scope. It's just things to help people feel better, especially I don't know about you, but a lot of my patients are high functioning people. They work or they push their life to the max, and it's nice to be able to come in and just feel better when you leave.
And that's why I love aesthetics. Everyone cares so much about themselves and how they look, how they feel. And so you're always, you have those patients who really want.
They want that.
They want
right?
it.
They're not so much like, you get your situations where people have had sad stories, but for the most part, people are there because they want to feel better, and it feels good to be able to do that for somebody.
Agree.
Well, we are so happy that we had you on, and we could literally go forever and ever in every different direction. So we'll have to have you back again. You should come anytime. And
I just want to say I'm so proud of both of you because, even like starting here in the beginning, you guys have always been driven, but you never stop learning. You never stop trying to grow, and you're never going to like plateau. You're always going to be the best. So I'm so proud of both of you, and I am so grateful that you invited me to be on your show.
Thank you.
Thank you.
We're grateful to have you, and we're just so happy that you came to Tallahassee Plastic Surgery, 2 years ago at this point? Yeah, we're just so happy that our paths have crossed, and we are proud of you.
Can't wait to see everything that you build.
Yes,
can you tell us where people can find you?
Yes.
Sure. You can go on Instagram. We're The Aesthetic Blend TLH, or we are on Market Street. And if anybody wants to go to our website, it's theaestheticblend.com.
Awesome.
Yay! Thanks,
Thank
Rach.
you.
Thanks, Rach.